Good morning, everyone. I hope that you can hear me. I am here going live. Good morning, everyone. I hope that you are able to hear me. And I am here going live on Wasatch Crest's Facebook. So, welcome. Thanks so much for joining us. So, my name is Lindsay Fenton, and I am the Director of Utilization Review here at Wasatch Crest. I am also a licensed CMHC, which is a clinical mental health counselor. And I also specialize in trauma and addiction. So that's kind of what we are here to talk about today. We are here to talk about EMDR therapy, which is a form of trauma therapy and can be really super helpful and beneficial. And in my experience being trained in it and working with clients, I've really seen some pretty incredible progress. So I'm coming to you live from my office here at Wasatch Crest. I'm on the third floor attic. As you can kind of see, there's a window here, really beautiful view. We are a treatment center in Heber City, Utah. We treat individuals struggling with substance abuse and mental health, co-occurring mental health issues. And our house here is 20-bed residential facility. And then up the road, we have our transitional sober living 8-bed house. So today I'm here to talk to you about EMDR, kind of introduce to you what it is, how it can work, maybe it would be beneficial in your life and how we kind of incorporate those practices into Wasatch Crest and how we treat our clients here. So what a brief overview of EMDR therapy. It stands for eye movement desensitization and reprocessing therapy, which is a mouthful. So basically, eye movement means eye movements. Desensitization is the goal is to desensitize the trauma, and then reprocessing would be reprocessing the trauma. So EMDR. It was developed. It's been around, really being used for about the past 20 years, and they've done a lot of studies and really found that really beneficial. And the cool thing about being a therapist and using it is oftentimes with traditional talk therapy, which obviously I do a lot of, it can be hard to see, really concrete and conclusive results. And with EMDR, I've seen a lot more rapid, conclusive, measurable results, which has been very cool for the clients as well. So basically, it's used for trauma. And, people tend to think, especially when we have people come in here, that they don't have trauma or their trauma isn't affecting them. And what we've kind of, realized, especially when we talk about the substance abuse and addiction population, is that most people, the secondary issue is the substance use. So they are using substances to kind of self medicate, self treat, cover up, numb a trauma experience. And I think, identifying the trauma at first is sometimes the hard thing because people say, well, this happened to me, but it doesn't affect me. And, when we get into it, you realize it does affect them. So when we talk about trauma, it doesn't need to be these huge traumatic life experiences. It can be little things over time. And often that is the most traumatic is some chronic childhood abuse or stuff like that. And so what these traumas tend to tell us about ourselves is it's a negative cognition that we develop. So we go through some sort of traumatic episode, no matter how big or small it is, and it tells us something about ourselves, which is, maybe it's a safety issue. If there was some sort of violation or crime committed or assault, I'm not safe. If it was, and that could be with abuse as well. If, there's some sort of abuse going on with caregivers or people that are supposed to protect you, it could be I'm not safe or I'm not loved. And what we're really talking about is these really deep down core emotions that form when we go through these experiences. And then we tend to internalize them. And then that's what we believe about ourselves. So the whole goal of EMDR is to identify these traumatic memories, identify what the negative cognitions are. What did this trauma tell me about myself? And then trying to reverse it. If the negative cognition is I'm not safe, then maybe, the goal would be, I'm safe now. And going through those processes in a safe space is also really important. So, a lot of people have questions about how EMDR works. It sounds weird. I get it. Um, in my personal clinical practice, it does say eye movement because that's in the title. But I've worked with a lot of different types of clients, and I found, especially with older clients or people who have visions or contacts or glasses, eye movements can be difficult. So I actually have this right here. This is my TheraTapper. And you turn it on, and basically each one of these tappers vibrates, and the client holds them in each hand, and it's the bilateral stimulation that you need. So whether it's eye movements where your eyes go back and forth, or tappers, or you can tap yourself, it's bilateral stimulation that your brain needs. So that's kind of what the process is. And so what we do, how it works is we start, the first few weeks, we kind of do a treatment plan with you, and we say, hey, this is, we list the traumas, and we focus a lot on, when we talk about trauma, the body sensations, and that's a lot where our trauma is stored. And when we talk about PTSD symptoms, that's what we see. It's that feeling you get, and some people they mistake it for anxiety, and the hyperarousal and things like that. So that's where we try to identify where it's being affected in the body, and those sensations, and then we kind of develop a treatment plan of the experiences that we've had, and go through the process. And so it's basically, there are different parts. You do the treatment plan, you do the processing. The processing can be very difficult because we are, kind of reliving your most traumatic experiences. But the change is that we're in a safe space, and that's really important, for the clinician and for your therapist, and you to feel safe in that space to kind of relive the processing. And the whole idea of EMDR is that when we go through a traumatic experience, we go and we stop here, kind of at the climax, at the top. But so that's why we're having those, intense physical reactions or emotional reactions, because we haven't processed it. We haven't reprocessed that. So the whole idea is, you go up and then you go down, and then, we change the cognition, and yeah, that's it, right? Super easy. But it's, people who choose to go through this, it's really, I just have so much respect. The clients are so brave to do this, and we see so many different reactions, and people say, how long is this going to take? And I've seen people reprocess memories in 20 minutes. I've seen it take 3 sessions, which could be a few hours. So, and it's your brain that kind of does all the work. And especially in substance use, there is kind of like a protocol for reprocessing. Well, not reprocessing, but because we can't reprocess triggers, but what we can do is kind of desensitize triggers. So that can be really helpful. There's also, as far as like a good client, I definitely use EMDR practices and principles as a clinician now. I come from a very trauma-based place and use those principles, but a lot of times people who come into Wasatch Crest are very, they're in crisis mode, and our goal here with the, short time that we have them is to kind of stabilize. So we can't really get into the whole processing, because that kind of is difficult for clients when they're not completely stable, but it's a really nice to kind of start that process. I run a trauma group here every Tuesday, and we definitely talk about, the body experiences. Where are we feeling this in our body? Identifying that. We're talking about what our negative cognitions are. Where do these come from? And realizing that. So a lot of EMDR principles I definitely use here at Wasatch Crest with my clients and in our groups. Especially for substance abuse recovery. I mean, most of the clients that we see here are dealing with trauma. Again, substance abuse generally is a secondary response to that trauma, so they can kind of deal. People who experience trauma live in survival mode. And the kind of goal is to get them, living and enjoying life again. Nobody wants to operate from survival mode. So EMDR is super helpful in kind of going through that. I've seen an example of kind of how I've seen positive results. I worked with a client for a while who experienced some chronic sexual abuse that happened in a basement. So the client never really realized that every time they went down to the basement, they would have this response. And it took a minute to kind of identify that these were connected. So after doing quite a bit of EMDR work, the client was now able to go into a basement with no response, which was pretty amazing. It changed their life. And it's really cool to see that. So it's definitely hard work, but it's a great start. And then often with our clients who are interested in continuing that form of EMDR therapy, we can definitely, with aftercare, we can set you up with aftercare, set you up with a provider that's in network with your insurance that is trained in EMDR, so you can focus on that. So that's kind of what I wanted to talk to you guys about today. I really appreciate your time and attention, and make sure you're following us on Facebook at Wasatch Crest. You can share this video with your friends, and then obviously to learn more about our treatment programs for you or your loved ones, if you need help, we have a 24-hour admissions line that we would be happy to help you with. So again, thank you for your time, and we'll see you soon. Bye.